All right, I'm going to walk through three different patients that are a little different points in life, and review their story a little bit and what we did, and help you kind of see the process. So this first one's a young gentleman, professional, who lost a fair amount of hair on the front and top of his head at a pretty young age. And it was pretty devastating to him. He obviously didn't like what he was seeing and asked us to give him a hand. And so we did a hair transplantation for this young man. That process takes most of a day. So the way it typically works is you get a short haircut. We numb up the back of the head, which is typically where we take the grafts. So we numb this area up. We'll harvest the grafts. And then the next stage is we kind of numb the front and top, and we'll make little holes with a needle. Those are called recipient sites. So we create all of those. And then the third stage is when we take all the little tiny grafts and put them into the needle sticks, sort of implant them. Now, a typical graft is about 0.9 millimeters big. And again, we just use a needle stick as a recipient site. So it's very tiny. And when you make them very small like that, it becomes more undetectable. In the past, they used to do transplants with like 40 hairs, and it was the size of a pencil eraser. And I'm sure you guys have seen that in the past, and wasn't a very good look, kind of looked like a doll. But now we can do single, 2, 3 hair grafts at a time in just a tiny needle stick. So on the perimeter in the front, we'll do all single hairs, and then as we get further back and more in the center, we can put 2, 3, or 4 hair grafts in order to provide more hair per graft. But along the perimeter in the front, we will just put in singles, so they'll essentially be invisible. You won't be able to tell that they were transplanted. So this gentleman went through that process. Again, spent most of the day with us going through that. Had a very nice growth. He actually came back and did a second transplant procedure after this to achieve some more density. So a nice young man, super thrilled, got his hair back, and it's a permanent solution for him. So we're pretty excited for him. For our next patient, this is a early 40s professional gentleman that had lost a fair amount of head on the frontal and middle areas of the scalp. And he came in and asked us to help him out, move a little bit of hair for him in the form of a hair transplantation. So we're happy to do that. So one of the things that we would do when he came in is examine his scalp with a dermoscope and see exactly what was going on, perhaps show him the miniaturization, hopefully healthy scalp otherwise. And then we could talk about the process of what we would use to harvest the grafts. So we have lots of options available. One would be the robot, another would be a neograft machine, another would be a manual extraction of FUE, and then a fourth would be an FUT or strip technique. We don't do as many of those as they leave a linear scar, but in some cases, that's the best way to get the most grafts, oftentimes in females. So in this case, we use a neograft machine to do the harvesting, and this after picture is about 1 year later. So if you compare the before and after, because of the density of the hair and the proper framing and sort of normal look to his hair, it just makes him look like a younger guy. And so I thought it really kind of improved the appearance and did a great job for him. He's thrilled with it, and who knows, possibly might come back to get a few more. Our third patient tonight is a gentleman that had pretty diffuse loss from the crown all the way forward. Also had sort of an irregular shaped hairline, which bothered him. So he came in for a larger hair transplant, about 3,000 grafts, all done in one session. And he had a very vigorous response. And so as you can see in his afters, he's got quite a bit more density on top of his head. And then we were able to adjust his hairline to kind of smooth that out. One of the things that is important with hairlines is that it not be perfectly smooth. We need to have some irregularity like a normal scalp would. And so we'll like deliberately make little tiny irregularities in the hairline to make it less conspicuous. So you have the hairs that grew on top of your head, we can maybe call those the natives, and we have the hairs that we take from the back and graft into the scalp, and those would be the grafts. And so the natives in the zone where you're losing hair are still subject to being lost over time. And so as your hormones go, and those hairs can still be miniaturized. So when you see his before picture, we're catching it at a point in time where it's like maybe 2/3, 3/4 gone, but he still has a fair amount of the natives. If you progress forward a number of years, he'll lose the natives. And so I actually saw this gentleman a week or so ago at a social event, and he kind of let me know that he's lost some of the natives over the last 5, 6, 7 years, and he's ready to do a second procedure and kind of load back up. And so that's an important thing to realize, is that we'll try to plan at your first consult what we think your hair is going to look like in the future, so that we can provide you a result that will always look natural. So he still looks great, just not quite as dense as he did in his after picture here. But overall, still looks really good. And so we'll plan your transplant to make sure that you look good, even if you have subsequent hair loss. And we'll have a plan to execute if you do, what we might do to kind of keep up with that. In addition, we have medical hair treatments along with our surgical transplant treatments. And so we can help you extend your natives and or strengthen them or improve them with some of the hair medical treatments we do, like our own Hair Max procedure.